So welcome. We're talking about support and planning, and part of that is in the kind of umbrella of what palliative care is, so let's start there. Palliative care is both a philosophy of care and an organized, highly structured system for delivering care. Palliative care within Kaiser has 3 different locations, if you will. They have 2 inpatient teams in the hospital, one at Northside and one at Piedmont. Then they have an outpatient clinic, one here at the Southwood Specialty and one at Cumberland. And then we have a home-based palliative care team. And all of that falls under the umbrella of palliative care, and that philosophy is support. Palliative comes from the word palliate, which means to ease or relieve. So palliative care is supportive care. It's a comprehensive treatment of symptom management, the relief of stressors that are associated with having a serious illness. So the palliative care department gets to know you. We try to identify the challenges that you might be having. We look at you as a whole person, mind, body, and spirit. So we get to know you on your family level, on your physical level. What are some of the trip-ups you might be having psychosocially, financially, spiritually? We have a team that addresses those things. Okay, so we already talked about that.
Okay.
So another program within the palliative care umbrella is called Advanced Illness Care Coordination. I have my cards and I have a brochure. It's a free program. There's no copay, and it's meetings with me, licensed clinical social worker, and over 30 years of therapist experience, and we talk about, in more depth, how your illness is affecting your life. What are your coping mechanisms? What's working, what's not working? Resources, community resources, resources within Kaiser. Your financial situation, is that part of your stressor? Maybe it is, maybe it isn't, but we identify that. And spiritually, do you need help from the chaplain? So it's very personal, it's very intimate to get to know, for me to get to know you, and we figure out how we need to walk this walk together. It's not mandatory, it's just a great resource that Kaiser has provided, and again, free of charge. That's pretty awesome. We can do telephone visits, or we can do meetings at Southwood, if that's your area, or meetings at Cumberland. I often will see what your appointments look like, and I can meet you before or after your appointments, so you're not making an extra trip. So there's a lot of flexibility and creativity in that program, but it's definitely well worth it.
Oh, sorry, I'm not doing my job. I apologize.
Okay.
Okay, so do you want to? Okay. This is the mic? Okay. So part of good health care, good quality health care in our country is knowing who to turn to in case someone is so ill that we can't ask them. We call this an insurance policy, just like having car insurance. A Georgia Advanced Directive tells us who's important in your life and who knows what you want and don't want in your medical care. So as providers, we always turn to the patient. So if the patient can tell us what they want, we are going to do what the patient wants. But sometimes, say you had pneumonia. Say you were very sick and confused because of that illness, we would need to turn to somebody and find out what was important to you and how we should treat you based on your wishes. And part of a Georgia Advanced Directive tells us who that person is, and designates then a list of preferences of what's important to you. And we're trying to get more and more patients to do this because things happen, accidents happen, and it's really important for everyone to have a Georgia Advance Directive. I have one, okay? Jane does too. And what people don't know is a Georgia Advance Directive has nothing to do with your finances, your anything other than what your medical wishes are, okay? It unburdens families. It takes away guilt. It makes it much more understandable who we should direct information to when there's a large family or a complicated family. A lot of us have those families. It makes things a lot easier. And what people don't know is that the Georgia Advance Directive, you do not need a lawyer. You do not need a notary. You just need 2 witnesses that are outside of your family members. And we actually have one that's pretty easy to read and understand, and it's not even the legal terms, but it's legal in the state of Georgia, and it's a very nice one. So if you would like to pick one up, I highly recommend that everybody does one. And it tells us, again, it's good preventative medicine. It lets us know what's important to you.
And then if after you're looking at it, you bring it home and you're looking at it, and you have questions or you want help filling it out, that would be a great reason to call me. You come into the office, we'll sit down together and go through it.
Mm-hmm. And then if you complete one and you bring a copy to us, we put it on your Kaiser record, and it'll always be able to be found. And if you wanted to update it, you just do a new one. You're kind of in charge of what you want on it. It's not something, we don't want to force you into any specific medical care. We just want to know what your preferences are. Okay? And so this is what I said. The Georgia Advance Directive has 2 parts. The most important one, honestly, is who your medical power of attorney is, who you want us to turn to. And the second part is the living will, which is what do you want, what's important to you. And again, you don't need a lawyer or a notary. Just need 2 witnesses. I'm not sure that I'm not sure we checked this. I'm sorry, guys. It's been a few weeks since we did Heart Failure University.
I have a question.
Yeah.
When you say you don't need a lawyer or a notary, can that be a dispute in the family? Because that would be
And
like...
finally tonight, ABC
Sorry.
News wants
Sorry,
to
let me-
join you in something right at the heart of the American family.
Okay. So say this again.
I'm just wondering, when you said you don't need a lawyer and you don't need a notary, if for some reason the family may feel like, this is not legal and you can't do this or you can't do that,
So
does that cause a problem if it's not?
no, so the only legal portion of a Georgia Advance Directive is you picking your power of attorney. Okay? And that is legal because you've chosen that person, signed your name, and 2 witnesses have signed it. So that tells the rest of your family you have said, okay, this is the person who I want to speak for me.
And that's what's legal.
That's the legal portion.
Okay.
The preference is for you to write down what's important to you, and then the most important part of that is actually to tell your healthcare power of attorney, your medical power of attorney, and the rest of your family, so nobody gets confused and upset by things. This is what's important to me. Whatever it is that's important to you. I've had people say, if I can eat ice cream and watch football, I'm good. That's what like whatever happens to me, if I can watch my game and I can eat my chocolate ice cream, I'm all right. If everybody in your family understands that, but more importantly, your medical power of attorney knows that, then we as providers turn to that medical power of attorney. It is written, signed, witnessed. We know that person is the person you designated, and then that person is supposed to speak on your behalf.
Okay.
And you should have hopefully told them what's important, and they will speak as your representative. They shouldn't make decisions about what they want. They should make decisions about what you want because you've told them that's what you want.
Well, I've seen it before where people have passed and the family just act a complete nut.
We see that a lot too, and this doesn't totally stop that from happening. The part that really stops it from happening is when a person stands up and says, hey guys, Thanksgiving dinner, don't you dare do these things to me. This is what I want. And we recently went to a talk, and it was pretty funny. There was a physician who signed a Georgia Advance Directive, and then he put it in his financial will that if anybody goes against my living will, my medical living will, and puts me on machines when I have told you that I don't want that, you are automatically cut from my will, my financial will. That's how serious he was about it. And he told his whole family about it at dinner time, like, this is...
No surprises.
There were no surprises. If you don't follow what I want, you're out of the will. You're out of the financial will.
People think it's, and understandably so, think it's a very difficult discussion to have. It's scary, and I don't want to talk about that, or what do you mean? It's better now than later, when there could be the chaos, there could be the even more emotion when someone's declining, or he's unresponsive, or can't make a decision, and nothing's been in place. Like Dr. Skold said, it's like an insurance policy with your car. You don't expect to be in an accident, but thank goodness you have insurance when you are. So that's the philosophy behind it.
And we've actually proven that patients who don't have an advance directive and something serious happens, when it's serious enough that they're, say, in the ICU, unresponsive on machines, and families don't know what to do, those family members feel a lot of guilt. They have a lot of trauma, and we've actually proven they have post-traumatic stress disorder. So this is a gift that you give to your family. This is not, yes, it's to protect you and what you want, but it is also very much a gift that you give to your family. And that's why you really do it. You do it so everybody's very clear on what's important. And I just really like this video.
We can all help the people who care about us make decisions at the end of our lives. And 9 out of 10 of you...
What about volume?
That's what I'm saying.
Can you guys hear this from here?
I think so. If we're quiet.
Okay.
You have told us that we should all be talking about it at all ages, what we want. And yet only a fraction of us have done it. And we know it makes a huge difference in the health of the caregiver as well as those cared for. So ABC News has taken cameras inside a vital, loving family, part of a new community, deciding to have the conversation.
This is 85-year-old Norm and his daughter Maureen.
5 today. He's still very, very active. He's a wonderful friend.
Throughout life, daughter and father have always talked about everything, except one thing: how to control the end of your life in the same way you control the prime of your life. So dad and daughter gather the family together, 3 generations, for an act of love.
And so now we're just asking that you share some of your thoughts about what you would like at the end of your life, so that we can honor your wishes.
They are part of something new underway for families in America that says having the conversation is a gift parents and children give each other. And there's proof of the difference it makes. Studies show depression rates plummet after a loss if the families have had the conversation. Renowned physician Dr. Atul Gawande says doctors and nurses see it firsthand.
When you're there in that moment and you're talking to the family and you're saying, how much will it bother your father if he ends up this way? And they say, more often than not, I don't know. We never talked about it. That it is incredibly traumatic for the family, for the doctors involved. There's often conflict. It can tear families apart.
So Dr. Gawande has become part of a team led by Pulitzer Prize-winning writer Ellen Goodman. It is called the Conversation Project. It is a kind of guide for families looking for a way to begin.
If we give them a way to talk about it and give people something to hang on to when they're afraid to start this conversation, they can do it and pass it on.
Families like the Jennings. They looked over the conversation guide before they sat down together. First, there's laughter.
Oh, my golf swing's still good.
And then Dad directly eases his daughter's guilt and worry about having put their mother in hospice.
I felt like that meant we were giving up on Mom.
She was in a lot of pain, and I think it was handled real well.
And next, Maureen asks her dad for clarity on what he considers a good end to a great life.
So if you were in a condition where you couldn't make decisions for yourself, how extreme would you want us to take measures to save your life versus letting you go?
Well, I think I'm ready to go anytime. You know, I wouldn't prolong anything. I mean, I've lived a great life. Pretty lucky. And because of you guys, you know.
Unexpectedly, a grandson is inspired to speak up about his own wishes for his own life.
That if there was no meaningful communication, that I would want you to stop trying to intervene.
We aren't ready for you to go soon.
Well, we're not ready for you to go that soon either, so.
One by one, the others weigh in, all ages.
Don't do that.
Happy birthday, dear Grandma.
And with that, another family has joined a kind of estate planning for the heart.
Go!
The conversation beginning in America.
So please tell us your stories in the days ahead about ways to begin the conversation with family members of all ages. Or if you don't want to have it, tell us about that too. My colleague and my friend, anchor Bill Ritter from WABC, and I will be reading your emails and looking at the great photos.
Okay. So again, it's a conversation for the young and for the old. And it's more of an insurance policy, and it helps families out. So, I'm not tech savvy. Have you guys noticed this? So.
Photos you're already sending us of your families. So go to abcnews.com, find.
How do I?
I think it's maybe their baby. Try escape.
Yes. Escape. Oh, it's over there. Thank you. Okay. Thanks. So these are the websites, and if you had any interest, definitely the Conversation Project is a very good site to go to, and Aging with Dignity and Georgia.gov also has, the Department of Health also has a lot of good information. And that's really our talk. So, but we're here to answer questions for you too.
And to give you a 5 wishes document if that's something you would like. Absolutely.
Is there an age limit on the 5 wishes or the
18 or older.
18 or older, yes. And a lot of states have shown benefit in really getting, I mean, anyone 18 and older should have one. I have one. Jane has one. But the big push is to get all adults 55 and older to get one. And, you know, regardless of what your medical problems are or not, we don't know what's going to happen, but it just helps us guide your care appropriately.
And obviously with an 18-year-old, there's probably a lot more health, there's probably a lot more life in front of that person. It's updated. This is not written in stone. You are not committed to anything. If you change your mind a week later, you rip it up and you do another one. Things happen, things change. The people that are your medical power of attorney can change. Something happens to them where they become ill or they move out of state, and you say, it's probably a little more convenient if I have someone, who lives more locally. Mm-hmm. So then you do a new one.
So does anybody have questions about palliative care also? I know sometimes people Google it and get a lot of different information. Just so you know, here at Kaiser, we work alongside the heart failure team. We work alongside a lot of other teams, and what we really do is we help support and help do symptom management, help with social issues, emotional issues, and just make people hopefully feel better as they're doing, all their other medical care.
I'm Beverly Washington, the dietitian here at Southwood. I've seen some of you all here upstairs, but some of you all haven't seen yet. But anyway, this is our information today to give you some information on low sodium lifestyle, because we can control your heart failure with your diet, with medication, but you need to know a little bit more about how you can control it with your diet. So we're going to give you some information today. We're going to do a fun pop quiz. Then we're going to talk about some just basic information about salt and sodium. I know how many of you are reading food labels. Pretty good at reading food labels. And I know we eat out at some point, right? So we'll see how that can impact your sodium level there. Okay, this is our first pop quiz. You have the answers right there before you. So what is sodium? What would you all say sodium is? A killer?
That's what I call it, a killer.
A killer? Salt. Sodium is just a natural mineral that we find naturally in our food. And the reason why we talk so much about salt is because, as you can see, 40% of that is sodium and 60% is chloride. But the biggest bang for the buck is the sodium. That's the one that has the biggest negative impact on our health overall. So how would you answer this one? Your body needs sodium to help with the daily body functions. That's A, B, C, D, or E. E? How many E's we have? Oh, y'all are good. Okay, you're right, because there's something called essential sodium, which your body does require to perform those functions there. So does anybody have any idea about what is the small amount that your body needs per day to carry on those body functions? How many?
1,500 to 2,000.
What is a small amount?
Okay, we're going to show you. So the question here is, everybody needs a small amount of sodium for daily body function. That's true, right? So, okay, so this one's going to find out how much do you need per day just to carry on those little everyday functions.
Maybe 500 or less milligrams?
Oh, you're pretty good. The answer is 500. So your body just needs a small amount, but we tend to take in more than what we need. The average American may take in, as it says, about 3,400 milligrams of sodium per day. And so that's why they're trying to get your sodium level to be lower. Your diet intake should be what? You all hear that word all the time, 2,000 milligrams per day. Because we do know that when we're eating food throughout the day, if we're going out to eat a lot, you may have a very high sodium intake there. Okay, how would you answer this question? Most sodium in our diet comes from B. How many say B?
I say B.
Okay, y'all pretty smart folks. Okay. The answer is, it is because, as you can see, 77% come from your processed foods. So the letter is B. We get a small amount from the other places, but the more we buy packaged foods, processed foods, you're going to get a whole lot more sodium content. So how would you answer this one? Salt is used in food as?
Probably a preservative.
Yeah, preservative.
Oh, it may be all of them. I would say a preservative.
All of those, yes.
Could be all of them, actually.
All of those can be a big factor. So salt is not so bad sometimes, right? So how would you answer this? Sea salt is a healthier alternative to table salt. They're talking about using sea salt on French fries because they think it's a healthier item.
It's still salt.
It's still salt. Anything that has that SALT at the end is considered salt. Let me just show you. When y'all see, usually when you read a food label, it's going to be based on like 1/4 of a teaspoon, which is a very small amount. So 1/4 of a teaspoon of just regular sea salt is almost like same like your table salt. It's all up there in those high numbers. So no matter if you're choosing sea salt, table salt, kosher salt, they're all going to be considered very high. Now, every 1 teaspoon of salt is about how many milligrams of sodium?
It says 23.
Yeah, that's why they tend to say if you can avoid the salt in your diet, because every 1 teaspoon of salt that you use, that's going to be close to that 2,300 milligrams. So that's the big thing. That's why they say avoid salt. So when you hear people say use sea salt, now sometimes the chef may like the sea salt because it's coarser, it has a different taste, but still it's not like a free sodium content there. How many think sometimes when you buy things like no salt or light salt are a better replacement than regular table salt? So if you buy something called light salt, or it says light salt or no salt, you may think it's free of sodium, but it's also very high in potassium. So unless your doctor recommends this, this is not the best choice. Your best choice is using your spices and herbs for the most part. So when you see on the can it says no salt added on the food package, does that mean the food has no sodium in it? No. Right. All that means there's no salt being added, but there's a lot of something already in that food product there. Okay, so we already know that we can find a small amount of sodium in our food that's going to occur naturally. So when you're eating fruit, basically, as you can see, it's 0 almost. So you don't have to worry about fruit content because it's considered very, very low or none there. Anything like your fresh frozen vegetable, when you compare your fresh or frozen to more of, without the salt, it's between 1 and 70 milligrams. That's considered very low. If you do anything like we already know, tomato juice can be very high. That's why you say if you drink tomato juice, use your low sodium there. But as you can see, when you buy anything, even with the frozen, it has like the cream sauces, the cheese sauces on that. That's going to be a little bit higher sodium content. So you are trying to find those vegetables in the frozen section that doesn't have all that creamy sauce on there. Just some plain old broccoli. What do y'all like to eat? Carrots? Everything? Okay. Now even things like your bread, cereals basically are considered very low in sodium as well. So when you're eating oatmeal, you're eating grits, you're eating Cheerios, those are considered very low. Now when you're buying something like Raisin Bran, I noticed on the box of Raisin Bran, that's like 360 milligrams per 1 cup. Or actually, per 1 cup there. So if you're eating a whole more than that, it's going to be double that, almost like 700 milligrams of sodium. The one that has the least amount is going to be something like shredded wheat. Yeah. It's like 0 if you like shredded wheat.
The frosted mini wheat.
The puff rice. 0. Yeah. So when you look on your label, look for the sodium content there. Most breads are going to be not such a high thing there. So let's see, what else? So as you compare your dairy products, the most thing we find is going to be the cheese category. So if you're buying a lot of cheese, like Velveeta cheese, processed cheese, that's going to be a higher sodium content. Do you all know what cheese counts as really pretty low in sodium? Have y'all found one that tastes pretty good?
Swiss cheese.
There's the one called Swiss cheese. It's like 55 milligrams of sodium. So if you like...
But you have to acquire taste.
I know. That's what happens. Sometimes they don't taste quite as good. They don't taste quite as good there. So when you're reading labels again, look at your sodium content to see what's going to be the better choice for you.
And I didn't like goat cheese.
Oh, okay. You tried them at different levels. Okay. So let's look over here. So if you look over here, you can see when you're buying anything like your beans in the bag, it's all frozen, it's okay. But when you buy it in the can, that's going to be a little bit higher sodium content. Yeah. And that's based on a ½ cup there. When you compare your unsalted nuts to your salted nuts, that can be a big difference there too.
Explain
Yeah.
About when it says beans can under ½ cup. Explain that to my husband, please.
In terms of beans?
Mm-hmm. In terms of when you say you don't have the serving size.
Oh yeah.
If you explain that.
So serving size is like a ½ cup. This is considered right here. A ½ cup is a serving. Now that's just a serving size. You can eat more than a ½ cup. But but again, if you're eating, let's say if you're eating a whole cup of those beans, that's going to be about 800 milligrams of sodium.
A cup and a half.
Yeah, so it just depends on your portion. Yeah,
Explain to him, you have to add those numbers up.
yeah, so it all adds up. So that's the key. When you look at your sodium level, that's a good thing. Let's see, in terms of meat is pretty, most of the time meat is usually okay. Of course, the ham's going to be in the higher category. If you're buying your tuna, of course, you want to buy it in the water versus the,
Vegetable.
much lower there, content there. Now, let me just show you a couple of things. CDC, they found there's like 6 to 10 different things that's considered really high in sodium that we like to eat. You wouldn't think breads and rolls, but when you think like croissants, biscuits, that's very high in sodium.
Yeah, biscuit can have.
Yeah, because you know how you make biscuits, right? Homemade biscuits. We already know about the cold cuts, right? So when you're buying your cold cuts, you want to buy your lower sodium, like Boar's Head. Have y'all found another brand that you all like, besides Boar's Head?
Well, we tried a no sodium, was it turkey from Publix? The worst thing.
Oh. Yeah, well, I mean, it doesn't have to be like zero, so you need to have some flavor there. So.
Please tell her that.
Oh yeah, some flavor.
Sodium,
Yeah, and I'll show you about reading food labels. But yeah, I mean, usually anytime you get anything in a package process, other than the deli meats, it's going to be having sodium in there. Yeah, but we're trying to find it lower. It's trying to get it lower, right? We're not going to be like zero.
That was so nasty.
Okay, we already know pizza's going to be high because that's how pizza's made. A lot of cheese, sauces, and things like that. We already know soups. Depending on how we make our sandwiches, those can be very high in sodium too. Yeah, laid on thick.
Yes, that's good.
Yeah, those are just, you can buy the unsalted pretzels now. You can buy the, unsalted chips. So you can find ways to decrease your sodium content.
Yeah, the most all the chips.
These are some other names when you all, besides just looking at the word SALT, and anytime you see baking powder, baking soda, those are also going to be another indicators of high sodium content. That brine is like soaking meat like in salty water. Pickles, yeah, those are considered that. So even sometimes when you get medication, if you see the word sodium in that, that's another big factor there too. So okay, now we get into reading food labels, but basically, so when y'all look for the label, you look for the total or the sodium content there. So your day of whole sodium is just like you got 2,000 milligrams per day. If you were to buy anything like Marie Callender's frozen dinners, that's about 1,300 milligrams of sodium right there. So you're pretty close to your limit right there. So when you check out your sodium, you're trying to look for that number. They usually say pretty much based on your serving size, that's based on that 1 cup there. So you're trying to keep most things as low as possible, under 400. When you have anything like 140, that counts as low sodium. So when something's low sodium, it's like 140. When something's very, very low, it's like 35 milligrams. So anything like on that lower end is okay. So again, you have to check out your sodium information. Also check out the ingredient list, just to make sure. You can look on the ingredient list. If you see salt in the first, second, or third listing, that means something you may want to not buy.
So excuse me, in this food label here, this serving is 1 cup, it's got 660.
Yeah, that's considered very high sodium. So usually anything over 400 counts as high sodium. So you're all trying to stay away from those high sodium, and that's also based on that 1 cup. So that has 2 servings in there. So if you're eating that 2 cups, that's what, almost like 1,300 milligrams of sodium. Yeah, and that's for that single item. That's not for the whole day. That could be like a lunch meal or whatever, and you've already pretty much got to your limit there. So when you look at your sodium information, look at the serving sizes there and see what's going on. Also, when you're buying like spices, you want to make sure it says 0 sodium. So when you buy like lemon pepper, people think that's considered no salt. But when you look on the ingredient, you'll see salt is there. So you want to buy your spice and herbs. Yeah, so you want to just double check when you look at your, people like to use things like old-based seasonings, things like that. But this is also very high in sodium. So the best thing you can buy is like your spices and herbs for your seasonings. Have you found anyone you like? We know Mrs. Dash is very popular, right?
Yes.
She's high.
Too high for me.
Different spices and herbs.
No,
Miss Grace, too high for me.
Yes.
I was gonna say, if you go to Little Giants, they have everything for $1.
Oh,
You
Where?
have Little Giants. They have 3 different spice house, and you have to know which one to go to. They have 3 different, they have a Latino spice house, they have a normal spice house, and they have a dollar spice house. They have marjoram, they have thyme.
Oh.
They have rosemary.
You
They have
get your little
rainbow.
bag for $1.
They have cayenne pepper. They have everything you need for $1.
Okay.
Also.
She didn't check it out. Okay.
Yes, I bought them all. If you go to the dollar store, Dollar Tree, they have the same stuff, $1.
Okay. So another way, we mentioned here, anything that has like 140 less equals low sodium. That's always a good deal. Try to keep most things on the low 40. 140 is considered really good. We said anything for the most, and sometimes when something says light, that doesn't mean low sodium. Because you can buy soy sauce, regular, and you can buy the lighter version, and it's still very high in sodium. So when something says low sodium, that's going to equal 140 or less. That's kind of a definition of low sodium. So that's always a good deal there. Because you can't always just go by healthy or natural, because that doesn't always mean low sodium either. Yeah. Okay. So here we go. People come to the heart failure clinic and we ask, what do you had for breakfast? The first thing they'll say is what? Sausage biscuits.
Yeah.
And look how much sodium that is. That's almost 1,200, isn't it?
Oh, yeah.
That's just the start of your day. 1,200. The sausage biscuit, if you do the sausage egg biscuit, that's like what, 1,280. So as you keep adding different things to it, the cheese, that's now what, 13. So we can quickly go to that high sodium content. People think sometimes going to Zaxby's, getting a salad is a good thing too. But as you look at that number, that's almost like 1,900 milligrams of sodium for that lunch meal or dinner meal. So that can be very high. So when you go out to eat, you have to be very, very careful about your selections. Just to show you how that can add up, let's see. This is a Cobb salad from Zaxby's. And that whole meal right there is like 2145 milligrams of sodium. I know, you've already overdid your allotment for the day. So just by that, and see if you look at what has the most, it's going to be your grilled chicken breast. Because they're seasoned. Now when you're doing it at home, you're not adding all that. You can add your different spice and herb, but they're adding some really special good seasoning to make that food taste really good. And it's going to be very high in sodium there. Let's see, what else? The Texas toast is on the high end there too. But anyway, that whole meal can be very, very high. So when you think you're doing a good job by getting that nice big old salad, think again. If you go to Subway, now the Veggie Delight is a pretty good deal because you can have a Veggie Delight sandwich and that's 280 milligrams. So that's considered a really, really good number. If you look at what else? You don't want to do the spicy Italian. No spicy Italian. That's what, almost 1,500. So again, when you're eating out, what they call the hidden sodium, you don't really see it, but it's just naturally in that food there. So the main thing here we need to do that when you're out shopping and when you're out in the restaurant, think about how you can rethink what you're buying, replace what you're buying, reduce, So think about the 3 R's. When we were in school, we had the 3 R's, reading, writing, arithmetic. So now we have the 3 R's for rethink, replace, and reduce when we're eating at your daily intake there. The reason why you hear so much about the Mediterranean diet and vegetarian diet, because they're all healthy, low fat, low sodium items there.